Hey everybody, this is Dr. Greg Pursley at PC Medical Centers, and I'm standing in the therapy department here at PC Medical Centers in Cape Girardeau, Missouri. And the reason why I'm doing this video is to teach you 3 simple hip stretches that will help improve the mobility. One of the things we work on here in the office is hip mobility and hip tightness. A lot of times people will come in and they have hip pain, low back pain, and low back pain that goes into the hips. Basically, both problems are things we work on. And one of the most common things we see is something called lower cross syndrome. If you're interested in knowing what that is, you can definitely go to our YouTube channel and look up lower cross syndrome where I explain that in detail. But lower cross syndrome is very common in today's society, and it creates hip tension, especially in the front of the hips. So the reason why I'm standing in the therapy department is because I wanted to show you how to do a few simple stretches to improve hip mobility. Now this is important. If you've watched any of my other videos, you'll see that I talk a lot about what joints actually need in order to function properly. Well, one of the things a joint needs is it needs space, meaning if a joint has proper space, something like this is a low back example, but the space in between the joints allows for movement, proper movement. If you guessed it right, you get a gold star, proper movement. In the hip, the proper movement should be able to swing back and forth. You should be able to go in and out, internal and external rotation. So 3 simple stretches that can help with lower cross syndrome and hip mobility are, number 1, we want to try to get the front of the hip to open up. Okay, so there's a couple ways to do that. Depending on your athletic abilities will depend on which one of these you want to do. So number 1, we're going to stretch the front of the hip, called the hip flexors, and we're going to do that by going backwards with the hip. Now there's 2 ways to do that, so I'll show you the first one. You can actually grab your ankle, grab your foot, and pull your lower leg up and back. So I'll do that from the side. We grab our ankle, we pull up and back. This will stretch the front of the hip. You hold that for 5 seconds and do that up to 10 times. So 5 seconds, up to 10 times. Now, if you can't get where you can grab your ankle, I know a lot of people that we treat have hip and knee problems and low back issues. There's a simple way of doing it that doesn't require that. What you're going to do is you're going to stand in what's called a scissor stance. You're going to take your hip, you're going to move forward with your pelvis, and it's going to stretch your front leg backwards. Okay? It's very simple. Very easy to do. 5 seconds, 10 times. 5 seconds, 10 times. Okay, our second stretch that we're going to do is going to stretch the outside of the hip. This is called the piriformis muscle. Very important. You're going to take your ankle, put it on your knee right here, and you're going to pull your knee towards your opposite hip, or opposite shoulder. You will feel the stretch in the side. Once again, you're going to do 5 seconds. You're going to do up to 10 times in a row. You can do this back and forth. Do the other one as well. Pull your knee towards your opposite shoulder, and you will feel the stretch in your hip. That's the second stretch to improve the hip mobility. The third stretch, we're going to actually use a table or a bed or something that has a little bit of height to it, because we're going to stretch the back of the hips. Some people would call this the hamstring. Okay, so what you do is you're going to take your leg, you're going to put it up on something, you're going to rest your heel on the table. What you're going to do is you're going to stretch straight down. You're not going to try to bend left or right. You're just going to go straight down and try to touch your toe. You will feel this up in here all the way down to your knee. Now, if that is too hard for you, then what you can do is you can take a lower, something that's a little lower than a table or a bed or a couch. You can do maybe a step or something that is a little bit less. Also, you can have a wall or something that you can hold on to, a chair, just in case you're less stable. But you're going to just stretch straight down and try to touch your toe. If you can touch your toe, great. Try to go a little bit further. But you do that once again, 5 seconds, 10 times. So to review, the first stretch, there's 2 options. You can do this right here where you pull your hip backwards. Or you can do the scissor stance where you stand straight up, put your legs out in this pair of scissors is what you look like. And then you bend your front knee, stretching the back hip here. And then the second one, you can stretch by sitting down, ankle on your knee, pulling your knee towards your opposite shoulder, which will stretch the side of your hip, called the piriformis muscle. And then finally, using a bed or something, a chair, a couch, or maybe even a step, you can reach straight forward and try to stretch out the back of the hamstring. This will improve your hip mobility, the front, the side, and the back, which will then reduce the movement problems that you have in your hip and make it more freely mobile. And it'll also reduce your risk of degenerative change. And if you look at degenerative change, you can see that you have this joint, which is a low back version, or low back example, turning into this joint, which is a degenerative joint, and that's what we want to avoid. So I appreciate you watching this video. If you have any other questions, click the link. We have lots of videos that teach you about different stretches for different parts of the body. But at PC Medical Centers here in Cape Girardeau, our goal is to improve the outcome of the patient without using steroid injections, medications, or surgeries. And we do that by improving the function of the body. Thanks for watching. Share this with your friends, and we'll see you next time.